think that as a culturally, we have this attitude of, just go with it, go with the flow. You need to kind of like, pull the sleeves up and then go on it. But parents need to get educated because ADHD is prevalent. Like in UK itself is about 5%. If you see the stats, that's how it is. So it's like a mental disorder. It's like anything. Okay, so if it's any...
It should not be underestimated.
No, it's not, because if you don't treat children, that will go into, in the adult life, anxiety, depression. I mean, like they have low esteem. You don't want that for the children. No. So I personally feel the children are the main one, very good to kind of treat them. It could be medication, or psychotherapy, whatever works for their kind of family and situation, because we do treatments for the circumstances. We don't just treat for a condition. Basically, say for example, if a child is having an ADHD, okay, and he's struggling with what he needs to do. Say he wants to go through the GCSEs, or he's not able to do his maths, English. Obviously, we need to medicate them to get through that stage. Sure. Maybe later in his life, he may not need it, because we treat for the circumstance of what's needed for that. Sure. That's what the medications are for. Yeah. They're not for like you don't need to take it for lifelong. Sure. These medications. But as I said to you, you need to understand, for parents as Indian families, we need to kind of more open-minded for parents. There's nothing wrong in it.
Nothing wrong in it.
Yeah, exactly. Yeah. So it's good, isn't it? You'll have more knowledge, because it's like what we have seen, like historically, a lot of studies have been done. When the parents go for a child's diagnosis, the questionnaires they do, when they're filling in, because the parents have to fill in as well. Yeah. They fill in and they say, oh God, this is what I felt as well as a child. Same thing. So even they're already diagnosed because nothing has been picked up with their parents. Sure. So you can actually see it's a very detailed questionnaire when we give the questionnaire it's like 2 or 3 kind of thing guidelines we do as a part of thing. Sure. And when you do that questionnaire, you will understand it's a kind of manifesting from there. But as an Indian family, you need to definitely open up and see the things. It's your own child.
Essentially, if you're not really accepting it or delaying it, you're harming a child.
You're harming a child, definitely. For children, definitely. That's the reason why it's very, very important in ADHD. You treat them just when they're in school, at the school age, like, like when they're up until when they go like study, like, after that, they can pick up what they want to, because you're increasing their self-esteem, boosting their energy, like, they're confident. Sure. They're not labeled, because they will be thinking, oh, I might be lazy, because why every time parents or teachers are saying, oh, you can't do this, why you're not doing this, why? Even for us as an adult, we feel very overwhelming, isn't it? Don't you think so? Somebody's comparing with someone, somebody's doing this, why you're not able to do? Your sister is doing, why you're not able to do? Or your brother is doing, why you're not able to do? Sure. That's very, very bad. It's just general. It's nothing to do with ADHD, but general, the how the child behaviors, how its development is like, that's how they learn, cause and effect. I think that's what they say. Like, say, for example, if a child is like shown a toy, when he throws it or it breaks it, and then it's a negative. He feels that, it's bad. Yeah. That's how he learns the consequences. From the consequences, he learns. And the same thing, if you're giving him sharing, and he feels that positivity, then he thinks, the sharing is good, breaking is bad. Yeah. So it's a cause and like an effect. That's what the children learn. Sure. From that's just basic science of it, how they learn. Sure. So we need to, the positive enforcement is very, very important. So something they're very good. You say, oh God, you're very good. Yeah. And something you're not. It's okay, it's fine. It's nothing to, you concentrate on the positive sides.
I've seen really successful stories who are having an ADHD. I'm talking about this adulthood. The people they're claiming, oh, okay, I'm diagnosed with ADHD, but now I'm this. Yeah. And they're proudly saying, and they're very, very successful. Yeah. If they pick up something, they will be, a focus on one thing.
Exactly. It actually navigates how they want to. I mean, there's a very good psychiatrist in US, I love him, Dr. Edward Halloween. He describes ADHD as having a Ferrari engine where the bicycle brakes. I love that phrase, because that's what it is. Because they have the Ferrari engine, so powerful. Yeah. And if you put them in that car, in a bicycle brakes, how they're gonna work? Yeah. They can't shut down. Yeah. So all this medication, the therapy, it helps them to strengthen that brakes. That's what it does, and they become a champion. Okay. So it's like a superpower.